Today we're looking at botched facial fillers. It's really important you watch this one. You're not going to believe what this woman now looks like. We're going to run through the video and I'm going to describe. This is so common. You need to know about it. Let's watch.
Without me knowing, he injected silicone in there as well.
So she says without her knowing, he, the supposed physician, injected silicone in there as well, is what she said. Now, of course that can happen. Imagine if I come in, I'm injecting someone, and you say, oh, I want to buy a vial of Juvederm, Restylane, put it in my lips. I come in there, I could have the outer syringe. You say, let me see the syringe you're injecting. Great. On the outside, it could look just like Juvederm or Restylane, but on the inside, I could have put anything in there. People don't know what's being injected into their face, and how could you? Because it can be doctored up, so to speak, with anything in that syringe. You don't know what you're getting. Very important to understand who you're seeing, make sure they're reputable, and one of the telltale signs is going to be that the price you're paying is less than what everyone else is charging, because silicone does not cost very much at all. It's extremely inexpensive. Fillers are expensive. Let's watch.
And your lips?
In here and in my lips.
So you put liquid silicone, a cheek implant, and did a cheek lift. How much did you pay for this?
I think it was like
$3,000 for all that?
$3,000, a cheek implant, a cheek lift, and injections for $3,000. Injections alone are typically $3,000. That is your first clue something's gonna be wrong. The price.
I talked to a couple other doctors who wouldn't touch me because they didn't know what he had done.
Right.
This is so common because you really can't remove silicone, bioalchemid, PMMA. The product is in there. If you've ever done surgery thereafter, the product is stuck down. It's hard to remove it all. It migrates a little bit. And the biggest risk is because you can't remove it all and it's stuck down around the nerves and vessels, it's very risky. And even when you remove the majority of what you think, you're left with deficiencies because you had to take good fat away from around that area. So by definition, you're not going to look normal after it's removed, and infection and other problems are rampant. We see that in the buttocks as well.
That's the thing with botched patients. Very few doctors want to take on the risks and complications that go along with helping these patients.
I didn't feel I had any choice but to go back down and try to get the person who did this to take it out.
So extremely common. I see a patient like this maybe every week, and the first thing we do is try and send them back to where they came from, because only that person knows what's put in there. I've had people go to people's houses, backyards, cars to get injections, everything. And if you don't know what's in there, how do you know what it is to take it out? So they go back to the same person who likely put something in a malicious way to try and get it fixed. It's a snowball effect of a disaster, as we'll find out.
What did he do?
He used scraper and a liposuction thing to get the silicone out. That's when I developed no feeling in this area. I couldn't, doing that. Used to be able to do it on both sides.
Hear what she says. First she said feeling, which is sensation. That's one type of nerve. And then she moved her face. She could do it on both sides. She lost motor movement. That's nerve number 7, her facial nerve. So in that surgery, because you can't really get rid of all that product, and when you try, the nerve was damaged. So now, not only does she have deformed face, she has, you can't really test sensation, but she's telling us she lost sensation. You can test motor movement by looking at it, so objectively, and she's lost motor movement. So now she will never be the same. Very, very sad case. And I think there's several take-home points. Is number one, $3,000 for the cheek implant and the fillers, very low pricing. Know where you're going. Make sure it's reputable. If it was the product that we would normally use, for most people it would be dissolvable hyaluronic acid, easily fixed, and she wouldn't end up with this problem. But the silicone was the original problem. Number two, when something bad happens, hopefully you went to a good provider, you can go back. If not, you really do need to find someone who specializes and takes these patients on. Your local coroner med spa will not want to do that for many reasons that we talked about. The third take-home point, every procedure has complications. There isn't a procedure that I perform that does not have complications. Even your skincare has complications in terms of managing the side effects from the AHAs and the retinols, chemical peels. Everything has a side effect. If you don't want side effects and aesthetics is optional, you can't partake in these treatments. So be mindful, find a great provider. I want to know what you think of this case. Let me know in the comments below. Please like and subscribe if you like these videos. I put a complete playlist up here on celebrity plastic surgery for you to enjoy. Stay tuned. Keep your skin and body beautiful, healthy, and vibrant.